Can we come in?
Sure, come on in.
Hey, Crystal. I have your day nurse, Asia, that I'd like to introduce you to.
Good morning.
Crystal, this is Asia. She's been a nurse for 6 years, and she's been here at Medical City for 2 years. She's going to take amazing care of you today. You're in great hands. And Asia, this is Crystal. Her husband, Michael, was here all night, but he just left to go home and take care of their 2 daughters, but I'm sure he'll be back later. So we're going to do that thing I told you about last night where we come in and tell you bedside shift report. It's where you and I have a conversation where I tell you kind of rehashing everything that happened last night, what brought you in, what we're going to do today, and Asia's going to listen and ask any questions.
Okay.
We do this for your safety so that way we can listen to any concerns you have and we can explain the plan of care going forward.
Sure.
For your safety, I'm just going to have you say your name and date of birth while we check your armband.
Crystal Crawford, 5/22/92.
Okay, perfect. Let's see your allergy band. What allergies do you have?
I'm allergic to sulfa.
So you have your fall risk band on. I'm sure you see that too. That's just because of the medications you're
Okay.
on and everything that's going on. We don't want you falling, so we have your bed alarm on, okay?
Okay.
So you came in for chest pain. They gave you some morphine down in the ER. You told me you have a history of hypertension and coronary artery disease. So Dr. Bowers explained to you that you're going for a Lexi scan, got you to sign that consent. He explained that that's a stress test. Do you have any questions about that?
I don't think so. He explained it really well.
Great. Okay, so that'll happen this morning. And as you know, you're NPO right now, so that means actually nothing to eat or drink. Okay, so we'll take your water and we'll set it over here. So nothing to eat or drink until after the stress test. And then after that, we'll wait for the results. They usually come back in the evening. And then Dr. Bowers or Dr. Hernandez will follow up with you about the results and tell you the plan of care moving forward, okay?
Okay.
Alrighty, so are you comfortable right now?
It's a little warm,
A
yeah.
little warm, you want us to make it cooler?
Sure.
Okay, we can do that. Alrighty, so since you're comfortable, let me check your IV site real quick. They'll need that for the Lexi scan, okay?
Okay.
Alright, does it hurt?
No.
Okay, you're saline locked right now, but they'll use it later. While we're both here, do you need to go to the restroom?
I don't think so.
Okay, so we'll keep your bed alarm on then for right now. Okay, so no further tests or treatment. We've gotten all 3 of your troponins. You know that's when the lab tech was coming in to draw your blood. It's a biomarker to kind of determine if you're having a heart attack, okay? So we're just waiting on that 3rd one to come back. So far they haven't been elevated, but we will let you know the results of the 3rd one when it comes back. Okay, do you have any other questions right now?
I don't think so.
All right, Crystal, so while I'm here, I'm going to update your communication board. This board is just how we keep you informed throughout the day with your plan of care. So some things I just want to address are pretty much everything on the board. I am your nurse, so I will update my name on your board, and I will also add my telephone number on here as well. You can also press your nurse button. Your patient care assistant today is Leslie, and she has been a patient care assistant for 10 years, and she'll take great care of you as well. Your doctor is Dr. Hernandez. Your cardiologist today is Dr. Bowers, who's doing your stress test for today. And the nurse leader of the unit is Kara. She'll be by to see you today for nurse leader rounding. Crystal, I would like to address your pain with you. On a scale from 0 to 10, 0 being no pain at all, 10 being the worst pain that you've ever experienced in your life, how would you rate your pain at this moment?
It's about a 6.
It's about a 6. Okay.
I don't want to have any pain.
Remember, Crystal, when we talked earlier, 0 is not really an achievable goal. We're working on finding the cause of that chest pain, though. So let's talk about a goal that we can work towards that will keep you comfortable at this time.
How about if we set your pain goal for 3, because that may be something that we can attain. Would that be okay?
Okay.
I see that your morphine was last given at 4. I can get that morphine for you. I'll be back in a few moments with that. What goal would you like to accomplish today?
I want to go home.
Okay, I understand that you would like to go home, but what are some goals that we can obtain for you while you're here?
Well, I've been so nervous with this chest pain. I would like to get up and walk with somebody the first time that I kind of go and walk around. Could someone help me walk or stay with me while I walk?
So how about we set a goal of walking 3 times today around the unit?
Okay.
So I will also put 3 boxes on the board. For every time you walk, I will check off a box. I also want to make sure that your bedside table is in front of you so everything is in reach. And lastly, I want to make sure that your call light is next to you as well. The red button on top is how you would get in touch with me if you need anything at all. You can call my number, which is on the board. Crystal, we'll be doing safety rounds every hour, but at this time, I'm going to step out to get your pain medicine. Before I leave, is there anything more I can do for you?
I don't think so. I think you answered everything.
It was a pleasure taking care of you. Thank you.